Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about eczema. So the idea is eczema is actually a group of diseases. It's not just a single disease, it's a single disease process, but actually a group of diseases that present with an inflamed, irritated skin. Most commonly, the most common type, of course, is atopic dermatitis, which is an allergic type of reaction on the skin. So eczema affects about 10 to 20% of infants and 3% of adults, and it is quite common in the United States. So the different types, I guess the way it presents, so it can present as just an itchy rash, it can present as bright red, it can actually be oozing or crusting, especially in like infants. It's common in the feet and legs, for example, and so we see it quite often. But a lot of times you're looking for a reason. Why is this happening? What's going on? So atopic dermatitis, we talked about, is what people usually are talking about when they mention eczema. And a lot of times it's an allergic type reaction to something. Contact dermatitis, which is another type of eczema, is caused by a rash from irritation from something touching the skin, for example. Contact dermatitis can happen from touching certain plants. It can happen because of certain shoes or certain materials, certain soaps or those kind of things. So it can also be an allergic type reaction, but a lot of times it's a touch type. Dishydrotic eczema happens when the skin oils are not released like they should be, and so the skin's not protecting itself, and so it gets the really dry scaling and so forth at that point. Nummular eczema, which is going to be a dry scaling type situation, but usually has round sores. And it often happens after, say, an injury like a burn or an insect bite. Seborrheic dermatitis is a type of eczema. We don't see it in the foot and legs, of course, because it's primarily in the areas where there's a lot of oil that can be released, a lot of glands. The most common spot is dandruff from the head. And stasis dermatitis, which is a very common problem that we run into in my practice, and it's a type of eczema as well, although we've talked about that in the past, because it's just a discoloration and drying and scaling of the skin secondary to poor blood flow to the lower extremities. So this is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 134, eczema. And I guess I should talk to you a little bit about treatment. The most common treatments that are used for many of these types of eczema are anti-inflammatory or dermatitis type treatments. So for example, it could be something as simple as a topical steroid. It could be just anti-inflammatory type medications. There are certain types of wraps, like an Unibut, that can be wrapped around that will actually help in this situation. There are certain types of lotions, for example, in Stasis Dermatitis, there's a lotion, a Marigel Blue, that we use in our office that you can actually do that improves the coloring of the skin and so forth. So this is Dr. Brandt Gibson. Again, eczema